And I mean, when we talk about therapy, we're very, very aware of the rule of confidentiality within therapy, and that we're not supposed to disclose anything that comes out of, that happens in the therapy room. Don't take that outside. So how does confidentiality work with clinical supervision?
Okay. It's a requirement. All professionals, many professions demand it. I went once to an osteopath to have my back treated and my shoulders treated, and the very first thing I had to do after 15 minutes, after he filled in the form, I had to sign it, and it was exactly like a contract, and there was things about confidentiality, and of course that's, in some cases, they've got to break confidentiality. It was all written there, and I had no problem with that, signed it. But it's a requirement. However, it's more than a requirement. How could a person goes to supervision or to a therapist, tell them all if they are not reassured that what they're saying is going to remain between them and their supervisor or their therapist? The patient or the therapist are not going to be that forthcoming if you are not guaranteeing them confidentiality. Also, there is a problem that sometimes I'm talking about patients, I mean patients and supervisees here, but patients tell things to their therapist that they won't tell to their friends, to their closest. They want to keep it all separate from the family, from friends and family. So to disclose it would be a serious breach, because the therapist is seeing you precisely because they know it stays with you, with certain exceptions, of course. And that's why, for example, you know me enough. I always say you should not befriend your patients. You should never make friends with them, because once you made friends with them, you actually have deprived them of a therapist. They will not be telling you the same kind of details, the same kind of issues that they were before, because it's a different relationship.
Totally different relationship. So, for example, if I'm coming to you as a supervisee and I am disclosing an element about one of my clients that I'm having issues around, and you pick up that actually I, as a therapist, need to be disclosing this because of the law, what would you be advising? How would you work with that? So I know that, for example, my client is sexually abusing children and no one knows about it. So I'm now aware of it as a supervisor, as their therapist. I've just made you aware of it.
Once I'm aware, I have the responsibility. I've got the knowledge. And therefore, my advice to the supervisee would be to report to the patient needs to be told, the client needs to be told, this is a reportable issue, and report it. You can't hide it. To hide it, you'll be an accomplice in law. You'll be responsible, just as